A 23 years old woman admitted with sepsis with right loin fin. She had a history of UTI and was treated by the GP with a course of trimethoprim that was commenced 24 hours previously. Which of the following organism listed below is most likely for the diagnosis? That means a woman 23 years old suffering from the urinary tract infection. And what is the most common organism for development of the urinary tract infection in case of the female? So it is a direct question, and the options are Bacteroid fragilis, E. coli, Clostridium difficile, Candida albicans, and Mycobacterium tuberculosis. So what may be the answer? So first of all, let's see the Escherichia coli or E. coli. E. coli is gram-negative rod. So it is gram-negative rod, facultative, anaerobe, and non-spore. Wide range of subtype, and some are normal gut commensals. Some subtypes such as 0-157 may produce lethal toxin resulting in hemolytic uremic syndrome. So E. coli or Escherichia coli, it causes the urinary tract infection, but some strength which may responsible for hemolytic uremic syndrome. And E. coli, it is gram-negative rod. And here you can see the enterotoxigenic E. coli. In case of the enterotoxigenic E. coli, it produces the enterotoxin that result in large volume of fluid secretion. On the other hand, the enteropathogenic E. coli, it binds to intestinal cell and it causes structural damage. In case of the invasive component, it produces the enteritis and large volume of the diarrhea together with fever. So some of the E. coli may causes the acute watery diarrhea and also fever. Resistance to many antibiotics used to treat gram-positive infection and acquire resistance rapidly and are recognized as producing beta-lactamase. So the E. coli is one of the beta-lactamase enzyme. That means it can produce resistance against the antibiotic. And the ascending infection, this point is very important, that the ascending infection of the genitourinary tract is most commonly caused by the E. coli. So in case of the female, the urinary tract infection is most commonly due to the ascending infection from the genitourinary system, and this is the E. coli. And other organism may also responsible, but E. coli is the most common. So as it is the UTI in the female, because she developed sepsis and right loin fin, so in this condition organism is the E. coli. Other option here such as the Bacteroid fragilis, it is not true. Clostridium difficile, it causes a pathology in the gastrointestinal system. Candida albicans, it can cause, but in case of immunocompromised patient, Mycobacterium tuberculosis usually not related to the UTI.